Yeah, that's a great question, and it's one that interestingly keeps being raised throughout this pandemic. And I find it quite interesting that it seems as though people have set up this sort of false dichotomy that it has to be sort of either or, that you either support economic health or you support human health, and that somehow these two aims can't coexist. And I find that fundamentally unsatisfying and patently untrue. If you actually look at the basis of health economics, you find that if you are ignoring the health of your population and trying to forge ahead with only concerns of commercial enterprise being at the forefront of things, you won't succeed. In order for an economy to be healthy and for an industrial complex to work, you need a population base that is stable and healthy, and you need consumer trust to be bought back. And in the context of the pandemic, you want people to feel comfortable about being able to buy things and being able to spend things and go out and do what they would normally do in terms of their shopping habits. And there have been polls that have been done across parts of Canada that have showed a lot of people are very reluctant to re-engage the same shopping habits that they had pre-pandemic. So look, even if you want to look at it from a bottom line, economic standpoint, you're not getting back to where you want to be simply by opening up the economy and saying health be damned. There is a way to do both at the same time. And there's a way to keep your population base healthy and safe while opening up your industrial infrastructure and your commerce in a stepwise and strategic fashion. Again, I come back to the point of this being a difficult to identify virus. It's a difficult to identify condition. We've all seen the big kerfuffle of the World Health Organization's backpedaling on the statement that was made last week, where they initially said asymptomatic transmission wasn't a big concern. And, a 180 quickly thereafter when this created quite a ruckus. And they said, okay, no, it's true. What we've been saying for a long time now is true. We don't know who has this infection more often than not. About 40% of people have no symptoms whatsoever when they have this infection. So when we look at, the summer unfolding and getting into the fall, looking at the prospects of the beginning of a flu season, which we know happens every year, there's no prediction around that, it's going to happen, okay? We want to make sure that we do everything that we can to avoid having the beginning of a second wave or not the ending of this first wave, because it's not over in many parts of the world, meeting up with the beginning of the flu season. That will be potentially catastrophic from both a health standpoint and from an economic standpoint, because if people think the lockdowns that were happening now were severe, wait till you see what happens if you double on a flu outbreak within many of our high-risk areas in our communities and beyond that. That is something that I don't think anybody has any clue in terms of how severe that could be globally. We need to do what we can to avoid getting to that spot. If we embrace technology that's going to help us identify the situation before it ends up becoming one that is coalescing with a severe flu situation, we're in good stead. If we decide that we don't need that, we're setting ourselves up for certain disaster. And we have that choice. There's no reason why we can't make the right choice right now.